Now we're moving down the face towards the midface. When I say the midface, I mean kind of the cheek here, nasolabial fold area. So the cheek lift, we also call it the midface lift. Again, these incisions are hidden in the hairline. We'll typically make them over here and over here, very similar to a brow lift. So I actually like this procedure because it restores the cheek volume with a lift rather than adding volume. So patients will often do fillers or can do fat grafting in order to add volume to the cheek. This can work for a while, but if we continue to do that over and over, or the patient has continued facial aging, as everyone does, following this, we can see that things get a little full. It can look a little, some people describe it as simian if you keep adding to the face without lifting. So you can see this patient, she had, nothing bad, but she had some nasolabial folds here. She has some descent of her cheek, and you can see that her face is starting to take on that triangle shape that we said can happen with facial aging. So you see here, I mean, she's lifted, her nasolabial fold is nicely effaced. We kind of restored that inverted triangle of youth. And so the recovery for this, patients do get a little bit of swelling around the eyes, and that's because we make these incisions way up in the hairline, but we do have to free up the tissues all the way down to the nasolabial fold. So that you can imagine, they do get some swelling around the eyes here, typically lasts about 5 days. No sutures or anything on the face, so nothing to get out from there. This is a little bit lower as far as patients saying that it's worth it, and that's 81%. So this can be helpful as an adjunct to a facelift. I have done it in many patients with just as an isolated procedure, but oftentimes we're doing this as an addition to other procedures. And the same is true for facial fat grafting. It's pretty rare that we would do facial fat grafting as a standalone procedure, though it can be done. So this is restoring cheek volume by adding volume. So these are the normal facial fat pads, and you can see as we age, these do tend to fall and they tend to reduce in volume. We kind of lose fat in our face as we age. This tends to act as a permanent filler. So if you can imagine adding filler to the nasolabial folds or to the cheeks, that is typically what we use facial fat grafting for as well. One challenge, as far as surgeons are concerned, some surgeons will counsel patients, some of this fat will stay, and your body will absorb anywhere from 0 to 100% of it. And the reason we say such a broad spectrum is because it's very hard to predict. There's been studies that could look into this, and these studies have said anywhere from 30 to 70% of this graft will what we call take, meaning it'll stick around. So you want to be conservative, and sometimes it does require a couple procedures in order to get it exactly right, because we definitely don't want to overdo it on the first one. Again, this is adding volume, and this can be added to minimally invasive like a mini lift, but it's really not a replacement for a deep plane facelift in which we're repositioning these tissues back up where we'd like them to get the volume. As far as recovery, it's similar to filler. There's occasional bruising. There is a donor site morbidity, meaning we just have to make an incision somewhere, whether it's the stomach or the leg, in order to get some fat harvested. And 82% of people, very similar to the mid facelift, say that this is worth it as a standalone procedure.